Hong Kong had another record-breaking day with over 6,000 new COVID cases. The government has decided to modify its hospital admission and discharge guidelines as it struggles with the massive backlog of people waiting to get treated. Winner Wong reports.
With 6,107 new local infections today, Hong Kong's fifth COVID wave has now exceeded case numbers from the past 2 years combined. There have been about 30,000 infections since the pandemic began, but there have been over 16,000 cases in the past 24 days alone. 24 deaths were also added to the tally, 15 of which were from the past 24 hours. The rest were belated reports from February 11th to 15th. With the medical system about to snap, authorities have now made modifications to its hospitalization and quarantine guidelines. Those who've been sent to a quarantine center can now be released if they test negative on the 7th day of isolation. But that's only if they don't live with someone considered high risk, such as a pregnant family member, an elderly person over 70 years old, or someone going through immunotherapy. If they don't meet these requirements, they will need to stay for the whole 2 weeks. Doctors will decide whether patients in hospitals are suitable for discharge. But generally speaking, they may be allowed to leave in as little as 7 days after their first negative COVID test. And finally, authorities have essentially given home quarantine an unofficial green light for those who are asymptomatic. Undersecretary for Food and Health Choi Tak-yi said anyone who's already been waiting at home for 14 days and tests negative is free to go out again without having to stay in a quarantine center.
In the fifth wave so far, there are already more than 10,000 positive cases, and also with the experience of hospital authority in managing over 30,000 cases since the epidemic, they have observed that a large proportion of young, fit, or asymptomatic patients, they only need observation but no definitive or very sophisticated medical treatment. So based on the observation and also the experts' view, it's safe to observe them at home while pending admission.
Health officials today also said a number of homes for the elderly have been refusing to take their residents back from hospital, even when doctors assured they are safe for discharge. Operators were asked to think of the bigger picture and not to add burden to the already overstretched hospital system. Winner Wong, HKIBC.